You're listening to Finn Voices on Healthcare Now Radio, where we highlight and amplify the voices at the forefront of health innovation that improves people's lives. Join us for an inside look at the change makers driving conversation and answering the most important questions in healthcare today. Thanks for joining us.
I'm Goel Jasper, and my guest today is Alon Ironi. Alon, a graduate of Israel's prestigious Technion University Engineering Program, had a strong career in high tech. But then, after 25 years in tech, something happened, and that led him to Theranica, the migraine treatment company he's with now, and he's been running since 2016. Alon, thanks for speaking with me today.
Great to be here with you.
Let's start at the beginning. We all have dreams. Our parents tell us we can do anything we want if we work hard enough. I wanted to be a professional baseball player. Then I wanted to be a professional basketball player. What did you want to be when you grew up, when you were a kid?
Wow, that's really going backwards. So honestly, at the very beginning, I mean, like the first memories I have of me thinking about what I would do in the future was probably related to agriculture, to be very honest, because my father was in agriculture, and then he worked for a company that did agricultural projects.
Right.
And he used to sometimes, take me with him to work, and I was, obviously it was fascinating to me. But pretty soon, I think maybe from the age of 10 or 11, I have to admit that I was attracted to technology. And I pretty much knew and wanted my career to be related to technology one way or the other.
This is like in the 70s?
It's in the 70s. Yeah. It's in the early 70s, okay. Early 70s and mid 70s.
Right.
I was attracted to math almost from day one. In 8th grade, we started studying electricity. I was fascinated by that. It was almost like a magic for me. So I thought, I definitely knew that I was going to do something that was closely related to technology. I thought about energy, mid-70s, the oil crisis, everybody was talking about energy, alternative sources or resources for energy. And I thought, maybe one day I can imagine new ways to get energy from other things other than oil and so on. So that was pretty much it. In high school, I was very much attracted to physics. So actually, at the end of high school, when I basically started my military service, like every other Israeli citizen at the age of 18,
right.
My thought was, okay, I'm going to do the service 3 or 4 years, and I'm going to study physics. And the best university for pure physics in Israel was considered, maybe still is, the University of Jerusalem. So that was kind of my idea entering into the military service.
Hebrew University.
Hebrew University of Jerusalem.
Really? Interesting.
But during the service, I served in the intelligence forces, not in a technical position, something that's I was an intelligence officer in different units, but I was really amazed by the power of technology developed, by units like 8200 and other units in the IDF that allowed the acquisition of high-value intelligence information. And to me, that was like, again, it was like magic, like things that I was exposed to in the sense of, where technology can get you in this sense. And so I ended up doing 4 years of service because I was an officer. And step by step, during those 4 years, I kind of like changed my mind from pure physics to electrical engineering, because I understood that if that's these magical things that I was exposed to, if that's what I want to do,
right.
The right thing to study is electrical engineering and not physics. And so that's basically what brought me half a year after completing the service to the Technion. And I started studying electrical engineering in the Technion. At first, again, I was more like a hardware type of person. My thought and my fascination went into the strictly hardware part of that. But again, I went through a change. I was introduced to all kinds of courses and contents as part of electrical engineering. And 2 things really attracted me more than others, and they were new to me. One is digital signal processing, which is a completely new field for me. Never heard about that. It's like...
and what's that in layman's terms?
It's It's the use of mathematics, in many cases even advanced mathematics, to process data, to manipulate data, to understand data, to present data in a more comprehensive way, and so on.
Okay.
In very layman words.
Right.
So that was one thing. The other thing is biomedical engineering, which did not even exist at those days. I'm talking now about late 80s as a field by itself, but it was a branch of electrical engineering that was related to medical equipment and so on. And so I took a couple of courses in that, and I felt, okay, that's my destiny. So when I
Biomedical engineering?
Right.
Was your destiny?
Yes.
And then you just took a 25-year break?
Yes, and the reason is well, it's called reality, because when I graduated, my preference was not to continue on the academic side, but to get a job and practice what I learned. And so I was looking for biomedical companies in Israel, and guess what? Although Israel was very much developed in terms of high tech already then, I'm talking about 1990.
Right.
There wasn't anything, not even one thing in biomedical or medical equipment, nothing that's related to real design. There were a bunch of companies importing equipment from Europe and from the States. So
you had nowhere to go.
Nowhere to go. There were two options, by and large. One was things related to weapons, developing all kinds of weapons. At that stage in my life, I was pretty pacifist, to be honest. I'm not anymore, by the way, but that was the time. And so I thought, no, that's not for me. So the other thing was telecommunication. Everybody in Israel was doing telecommunications. So I joined one company that had the name of DSP Group, Digital Signal Processing Group. Even the name is, sounds sexy to me, to be honest. And so I joined that company, and I found myself developing semiconductor devices for telecommunication, wireless communication, and that's what I did pretty much, for 2 decades.
In a nutshell, because we shouldn't just brush aside those 20 plus years in that world.
Absolutely.
The joke that it was a break, you must have learned some things that you are applying today at Theranica, and what were some key takeaways or key experiences that you had there that you see benefit you even today?
Well, first of all, I learned a lot. It didn't feel like taking a break from something else. To be very, very honest, I forgot about my early preference of medical equipment. I fell in love with telecommunication, consumer electronics. I participated in some really exciting projects, like for example, the first digital camera chip in the world, in the history of the world.
Wow.
One of the first DVD players in the history. And, I felt that I was part of a group of people, or privileged people, I would say, that were pioneering technology. So
Right.
it was rewarding. It was, and I learned a lot in terms of technology, in terms of management, in terms of doing business with different parts of the world. I was exposed to partners and companies with whom we collaborated in everywhere, almost in Germany, in China, in Japan, in Korea, in Taiwan, in the US, of course. So all that gave me a lot of depth in terms of the combination of technology, business, management, and so on. And then things started to repeat themselves. And
What do you mean by that?
another chip, another project, things were pretty much the same. And it was all obviously about the business, about getting, sales and revenues and so on, which is great and important. And we're all in it, of course, for a good reason. But in some point in time, which was, we're talking now, I was close to 50 years old. It was 2013, 14, 15, that time, the middle of the previous decade.
Right.
I started losing the excitement about what I was doing because I thought of the value of the things that I developed or managed the development of was not so great, in my opinion, anymore. Because it's like, let me give you a couple examples.
When you say not so great, you mean not so impactful?
Not so impactful, exactly. Right. The impact that it had on the life of on our life, on human beings was kind of like okay, but But
so what's an example?
So an example is in one of the companies that I actually founded, we developed a chip, semiconductor chip, that allows the reception of regular broadcast TV signals and presenting them over a cellular phone. So from the standpoint of the users of a cellular phone, it allows you to watch TV in real high quality over a cell phone. And so you can watch TV when you're away from home, which, okay, it's like, it's okay, but it's not really great. It's not a life changer or life-changing technology. Or even prior to that, I mean, the level of impact, again, I mentioned earlier that I played an important role actually in developing the first ever digital camera chip. That's a big it's a quantum leap in terms of our culture. Honestly, I remember when I actually argued with the CEO of that company. He basically, I came up with the idea of developing a chip for a digital camera, and he's like, listen, you don't live in the US. I mean, film are so, basically developing photos from a film is so much built into the culture. People go to the supermarket, they drop
Kodak agreed with him.
Right. I mean, why should we bother? And I had to introduce my vision to him.
Yeah.
And he was honest enough to tell me, you know what? Let me bring you in front of the board of directors and let them decide. And and they decided positively and so on. But again, talking now about 2014, 15, I was the things that I was doing at that time were highly sophisticated from the technological standpoint, but in terms of the impact they made on human beings, none of them was a game changer. And I was turning 50,
right?
And I thought, okay, I feel I'm in the peak of my energy and know-how and contacts and everything. What really do I want to do next? Do I want to continue with the same things? And I remember I had a job offer from one of the most successful entrepreneurs in Israel. He established a company in the UK, actually, and he offered me to be the CEO, to relocate to the UK and to be the CEO. And it was about satellite communication, which is nice, wireless,
Sure.
And again, it was very tempting, economically and everything, exciting and so on. But I thought, no, it's the same. It's going to be the same and the same and the same. It's time for me to try something new. And then a number of things connected together. One is my personal experience having to manage and to deal with chronic pain. I was suffering these years. There's no other word to put that. I was suffering from lower back pain.
Right.
Chronic lower back pain kept coming at me again and again. Episodes of 1 week, 2 weeks, sometimes 2 months, debilitating completely. And I was kind of like, I was really living my life in between one episode to the next. And I tried every single medication on earth, I believe, for that. And then I was diagnosed with some sort of deficiency in my spinal cord, and I was scheduled for a surgery. And while I was basically, a few weeks waiting for my surgery, my wife addressed my attention to an article in journals in Israel talking about other ways to cope with chronic pain, talking about a theory that was developed by a physician in New York that goes by the name of John Sarno. And one thing led to another. And to make a long story short, after 4 months of investigating and learning and practicing the basics of this technology, I recovered completely. I did not need a surgery, and I was back to life. And like everybody.
Sorry, you got in touch with him and said, "Hey, how can I apply this?" How did it work?
So I got in touch with an Israeli physician that is definitely one of the followers of John Sarno. His name is Dr. Nir Brosh, by the way. He shares his time between Israel and Berlin in Germany. He treats patients according to following the same methodology of the late John Sarno, Dr. John Sarno. I visited his clinic in Tel Aviv. He basically started treating me. The principles are based on deep understanding of the origins of chronic pain in the back or anywhere else, and a collection of mental, psychological, and physical practices that to my surprise, I started as not believing almost. I mean, it sounded to me like voodoo.
Right.
But I was so desperate that I thought, what the hell? Let's give it a chance. And then it was 2 or 3 weeks, nothing happened. But then after 4, 5, 6 weeks, I started feeling the change. About 3 months afterwards, I was running again up on the hills in the Carmel mountain, near Haifa. It's like,
wow.
I couldn't picture myself running again just 3 or 4 months before, honestly. So that was one big event. The other event was pretty much during those years, my senior daughter was diagnosed with migraine. So it started with her complaining about sensitivity to light and frequent headaches. And, and she was basically addressed by her primary care physician to a neurologist. The neurologist, sent her to CTs and a bunch of other examinations to rule out all kinds of bad things. And at the end, she was diagnosed officially with migraine, okay? So I was practically first time in my life introduced with this disease. I could witness at home how debilitating it was. My daughter, there were days that she couldn't go to school.
Right.
She had to miss exams. Her grades at school deteriorated, and everything that she was offered was all kinds of just medications, which some of them work. She told me one morning, I remember, what do you think I should do now? I have an exam today in physics or something, I don't even remember what, and I have a migraine. I said, well, what do you mean? What? I can't, I know the development. It's gonna be horrible in 2 hours unless I take the medication. I said, great, so take the medication. But then I'm going to be completely drowsy and fatigued for the next 48 hours.
Right.
And so I said, well, which one is worse? She said, I'm not even sure. That thing, combined with my own experience of overcoming chronic pain without drugs, was almost like the aha moment for me. It was, okay, I'm looking for something more interesting to do with my career, with my professional life. This is what I should do. I should do something that has an impact, not close to home, but at home.
Literally.
There must be a way, out of the entire technology that has developed so far, there must be a way to effectively help people like my daughter and myself without, being dependent on drugs and without suffering from the side effects. And I started investigating this, talking to people. And then one thing led to another. A good friend of mine introduced me to an Israeli professor, Professor David Yarnitsky from the Technion. Never heard about him, although he lives about a mile from me. We are practically neighbors in the same city, and he's a professor in the same institute where I studied. But Technion is a large institute. So I scheduled a meeting with him, and coming into this meeting, I already had a pretty rough idea of what I could do or what we could do and what technologies are relevant even for that. And to my surprise, he is the director of the neurology department in one of the largest medical centers in Israel. And I thought, well, I'm lucky to get 5 minutes of his time. And he's probably going to laugh at my ideas and send me home. And to my surprise, he gave me almost an hour. He listened carefully and he said, I think this is great. And I think the condition where I think this could be applicable most of everything is migraine. And I said, migraine? My daughter has migraine.
Just what you wanted to hear, right? Unbelievable.
Unbelievable. And so he said, listen, let me give you some literature, some homework. And he opened his drawer literally and took out like 12 papers. And he told me, read these and then let's talk again when you're ready. That's what I did for the whole weekend. I just read every single word in every single paper. I came back to him the next week and I said, we can do that. I know what you're talking about. We can do that.
Right.
And this is how Theranica was born.
So that was about 6 years ago?
That was about 7,
okay,
even
that's
7
right.
and a half.
Before the founding of the company.
It was,
because
it took us about a year or more of preclinical work and sort of like just playing with the idea and running all kinds of prototypes and so on until we actually had, were confident enough to say, okay, this is it. This is where, this is something we want to do for seriously. By the way, that's another aha moment. Because when we felt, my partner Ronen and another partner Slava, when we felt that okay, this has enough gravity that we may want to do something serious with this. I felt that I need some, or that we needed some confirmation from somebody that really knows.
Some kind of validation.
Some sort of validation.
Yeah.
So there was another neighbor that I knew very vaguely, but never really spoke with. His name is Dr. Shimon Ekois. He's one of the, I think, probably most famous entrepreneurs in medical devices out of Israel. And through a friend of a friend again, I was introduced to him, and I said, listen, I have an idea for a medical device together with my partners, and I hope you can give me some time to discuss this. And again, I thought he was going to tell me he was too busy and everything, but no, he said, okay, I'll schedule something. He gave me 45 minutes in his office in Yokneam, in Israel. The 45 minutes turned into 90 minutes. At the end of the 90 minutes, he told me, I have two things to tell you. First, I think this is a very, very viable idea, very interesting. Second, I want to be part of that. And
wow.
So this is how
he
became involved with the company. He's one of the co-founders.
So we have two more questions, and then I'll let you go and continue doing the important work you're doing. But first of all, Theranica is the company. The product is Nerivio. I should mention that, Nerivio, if people want to check it out. But so here we are, 7.5 years around after that eureka moment. And I want to know, now that you've been in the health ecosystem for a while, like, what concerns you about how the health ecosystem works?
Well, one thing that concerns me, and to be honest, overwhelmed me at the beginning, is the slow pace. I was used to the high tech pace. Everything was done quickly, and the emphasis is time to market and so on. In this industry, things, I almost felt at the first few years that everything around me was moving in slow motion. Like, what the hell is going on with these guys?
Like the Matrix.
Right. and it took me a few years to understand, okay, that's the pace of this new world. So, and it is a concern, because I think we, as patients, and everybody, unfortunately, every one of us, sooner or later is going to be a patient of the medical system or healthcare system, And so we're losing a lot of opportunities because of that. But on the other hand, I learned to recognize the value of very rigorous quality systems and mechanisms and so on. Because at the end of the day, they're protecting us patients from all kinds of damages that could have happened. So that's one thing. The other thing is still the level of conservative and the pushback towards new technologies is a concern, is a problem. People have different factors in the market. Physicians, healthcare system, health insurance companies. Everybody has their own reasons and fears and concerns, and I respect that. But as a result of that, there's a big loss of opportunities. We actually managed to do it pretty quickly compared to others, but I have a lot of friends from this world of digital therapeutics and all kinds of advanced medical devices, and there's a real gap between the level of the technology and what technology can offer to people, to human beings suffering from all kinds of diseases, and the rate of, let's say, the susceptibility of the system to accept these technologies. Now, it is what it is. That's what we're doing. So I wouldn't say it's a concern. It's a challenge.
Sure.
You have to play, with the system, but adopting the system rules. That's what we're doing.
And then the last question. Let's go to the other side of the coin. What jazzes you? What energizes you about being in health innovation?
That's a great question. So going back to those days in the the 2000 and the mid-teens of the century, I can tell you that in terms of the impact that just knowing that that what I'm doing as a entrepreneur, as a manager, as a business person, together with my partners, together with the employees here, to see the scope of impact that it has on the life of people is mind-blowing. We get testimonials from patients, written testimonials, video testimonials, audio testimonials, and I have to tell you a little secret. I very often
no one's listening. It's okay.
Right. I'm supposed to be experienced in everything, but very often I come to tears reading these testimonials.
Literally
Wow. Literally come to tears because people tell you. You listen to a young woman that couldn't really live for like 8 years, 10 years. Nothing helped, no medication, nothing helped. And then she was introduced to this device by her neurologist, and life changed. And one case, and another case, and another story, and another story. And you tell yourself, well, it's probably worth all the efforts and the frustrations and whatever, because at the end of the day, people are really, this is changing people's lives. That's not to mention my own daughter, by the way, who
she uses it
every time. She still unfortunately suffers from migraine. She's 28 now, and this disease doesn't go away, only after decades, if at all. But she's a medical student, by the way. She has full life. She still manages the migraine, but that's the key word.
Yeah.
She's not a victim of migraine anymore. She has migraine. She lives with migraine. She manages the disease. She doesn't take medications anymore. She uses the device whenever she needs. Of course, she has learned over the years to adopt all kinds of lifestyle practices that help her managing the disease. But is it fun to have migraine for her? No, it's not. But she can have full life with migraine because of this technology and because of her education, knowing what it takes to deal with this, to manage this disease.
Amazing. Alon Ironi, thank you very much for your time. Keep doing the really important work you're doing here at Theranica. We'll catch up with you some other time.
Thank you. It's been a pleasure.
Fin Voices is brought to you by Fin Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact on the world around us. Learn more at finpartners.com and follow us on Twitter @FinPartners.